Okay, my name is Sarah. I am now going to be doing the removal of a drain skill. So the first thing I'm going to do is verify that there's a physician's order for this, and then I am going to gather all my supplies. For this, I would get the suture removal kit, any cleansing supplies for the wound, steri strips, a clean towel or disposable pad to put under the drain, normal saline, and then of course the basin if I have to empty the drainage. So the first thing that I'm going to do is I'm going to go into the room, introduce myself, identify the patient with name, date of birth, assess if they have any allergies, ask if they have any allergies, and then I'm going to explain the procedure to them, provide privacy. I've performed hand hygiene, and then ask them if they have any questions. Okay, so the first thing I'm going to do is I'm going to put on my clean gloves, and the first thing I'm going to do is actually assess the drain, and I'm going to, it's going to be compressed because it's still in the patient, so I'm going to put the disposable pad under the drain and one near the site of where I'm going to remove it. So I would put this under the drainage area. I'm going to assess the contents, the amount of the drain. If it needs to be emptied, I'm going to fully empty it into the measuring container, and then remember that number so I can document the amount. And then I'm going to leave this decompressed, and I am going to remove the outside dressing of the patient's drainage site. So this is just holding it in place. I'm gonna pretend I actually removed all dressing. So I removed the dressing from the drainage site, and now I am kind of just assessing the drainage site, and then I am going to dispose of the dressing. I'm gonna dispose of my gloves, do hand hygiene, put on new clean gloves. So now I have new clean gloves on. I am going to put some normal saline on gauze, and I am going to cleanse the drain site. So what I'm going to do is I'm going to cleanse from the innermost part of the drain, so right around the drain, and move outward. So I'm going to be cleansing around the closest part, new gauze, closest part, new gauze, and then I'm going to move around to the outside, new gauze, outside, new gauze. And then I'm going to dispose of the cleansing, what I cleansed with. At this point, I'm going to open my suture removal kit. So I've got my suture removal kit. I'm going to find the suture that's holding the drain in place with my non-dominant hand. I'm going to pick up the suture at the knot, and then I'm going to cut just underneath the knot. I am going to remove the suture and then dispose of that, and then discard my suture removal. At this point, I'm going to tell the patient to take a deep breath because I'm going to be removing the tubing now. So as I inhale, I'm going to start to remove the tubing in a steady motion. If there's any resistance, of course, I would stop and take a break. And then if it really won't come out, then I would stop completely and notify the physician. So telling the patient now to breathe normally. I'm removing this, I'm removing the drain. I am going to now assess the area where the drain was removed. It is clean, and I'm going to apply a steri strip to assist with it approximating. And then if there's any dry dressing, like maybe there's very like scant amount of drainage, then I would put dry dressing on top as needed. And then I'm going to remove my gloves, discard all of my dirty supplies, remove all of this, and then I am going to perform hand hygiene. I am going to document the amount of drainage, the characteristics of the drainage, if there was any odor, document that I removed the drain itself, and then document how the patient tolerated the removal of the drainage.